far with the Ghana Research Mentorship Program. I'm really, really excited about today and about our panel who would be speaking to us. It's really, really an honor to have them both on here with us. I know how busy they both are, but then they made the time to come and speak with us. So without much ado, I'll just start with the updates. My name is Theophilus. I'm chair of InciSioN Ghana. And so far it's been 4 months since we started, and I'm really excited about how far we've come. There are little steps, but then we're making progress. So since March, we've successfully matched 44 mentees to mentors, and they are at various stages in their project work. For those on the waiting list, we had close to 300 people on the waiting list. We, short gap, decided to group them into groups of 6 to 8 to undertake systematic reviews according to their areas of interest. So far, we have 23 groups, and these are the various areas in which they would be undertaking the systematic reviews and meta-analysis. They, as of today, would be completing a course online on systematic review and meta-analysis by Johns Hopkins. And then we would take it from there. This is a sort of timeline for them. All right, I'm really excited to come to the main course of the day. And we have Miss Alice Chai, who I've had the privilege of working personally with in 2019 and 2020. She has been an immense help to me, helped me several times with academic work, and I'm really, really, really excited that she has made time to be here with us. And so I would give her the platform to introduce herself, and then we'll come to Professor Daniel Anson.
Thank you, Teddy. Can you all hear me?
Yes,
yes, we can hear you.
Great, and you can see me. I can't see myself, so and surely may I share my screen as well, please?
Yes, you can.
Okay. Right, let me share screen. Can you see my first page?
Yes, we can.
Yes.
Okay, perfect. Thank you, Teddy. It's been an honor to be invited, and truly I'm noteworthy. I'm still learning in this process of doing research, but my background is I am a upper GI senior registrar in my last year of training in the UK, based in London, Hammersmith Hospital at the moment. And I spend 3 years out of program to do my PhD. We usually spend 3 years, that doesn't count to our training, and then 1 year of write-up. And through that, I obtained my PhD at Imperial, continue to do research since. And Teddy's asked me to talk about how to write a research protocol. I very much hope this would be I was hoping this will be an interactive kind of session, in that please do feel to chip in. I am going to ask some questions, and maybe Teddy, you can facilitate in the answers. If you're a bit too shy, put it into the chat box. And if you're willing to speak up, it'll be great to hear your voices. But we're going to talk about how to write a research protocol. And it really is the beginning of establishing your idea. It is the time where you put your mind and your ideas down, and somehow for some others to understand where you come from. It is the beginning of establishing your research and having someone concurring to it. It's actually really important. It helps you shaping your mind, frame of mind, and testing out whether your hypothesis may or may not be correct. So in chat box, type yes if you have written a research protocol in the past. I can't actually, I'm going to try to see whether I can see the chats. If not, I can't see it with my screen. Maybe Teddy, you could tell me, or maybe I can see it. Let me see chat. Yeah, keep going. I'm sure you all know how to use chat box. Yes, yes, yes. 3 yeses so far. You can write no if you haven't. Good, no, yes. There's more people than there's, come on. No, okay. At the moment, kind of 50-50. Keep going.
Yeah. Getting to.
Good.
Still
So we've got,
50-50.
so I know that some people may benefit from this, some people may not, and feel free to share your opinion. Okay, so yeah, keep coming, it's okay, but 50-50 so far. Which kind of meant, Teddy, you know, on track. Some people should be starting writing their protocol now.
I agree. I agree.
or you know, in the process of. So hopefully it'll be useful. Okay, so I have no disclosure doing as my passion to teach, but I have no disclosure to make in here. Great, so I think we can close that chat about research, whether you've done research protocol. The first question I have to you is, why do we write a research protocol? Is anyone willing to turn on your mic and speak up? Or again, you can type in a chat box. Why bother? Why are we writing a research protocol? Why don't we just chat to friends and start experimenting or doing some research? Even a systematic review, why do we bother writing a protocol? What is it really for? At least some, yeah, anyone? If someone is speaking, I can't hear you.
I think someone is trying to speak up.
Yeah, please do. Yeah, go on, Abdul Rashid.
Yep. Good evening. Yeah, so I think the research protocol I've written, from what I've learned is to draw the framework of the, what do you call it, around the hypothesis you have, and knowing which questions to ask for the right answers you are looking for in your research.
Absolutely.
Thank you.
Yeah, so shaping a framework. Anyone else? Feel free to just turn on your mic, and if your mic doesn't work, put it in the chat box. I'd like to know what you think. Why writing a research protocol? It's not just the thing that your supervisor tells you to write. Not even a chat box. Come on. Okay.
I think it also helps as a guide. It helps as a guide
yes,
throughout your research project to be able to know what methodology you want to actually use, and it helps to streamline your work.
Yeah. Okay. So let me just go back to my slide. Oh, sorry. So you're absolutely right. The first two, you've got it all right. You're framing the research question, and by writing it down on a piece of paper, it challenges your mind and allows someone else to challenge your mind. It focuses the methodology that you're going to use. We'll come to examples later on. Retrospective, prospective, quantitative, qualitative. What is the questions are you going to ask? In the research protocol, you will also include what kind of analysis you're going to use to be appropriate to the questions you want to answer. Funny enough, research protocol is actually essential and important, and I'm not entirely sure of the regulation in Ghana, but certainly in the UK, the ethics approval takes much longer than the actual, most of the time takes much longer than the actual study. A lot of ethics approval takes up 6 months up to a year, and in the research protocols is essential when you want to apply for ethics. It also helps you to present this to stakeholders. What does that mean? Well, research costs money. So from being just a medical student or a junior resident, you want your senior registrars or consultant to buy in, and for that, you give them your research protocol to show. At the same time, at the level of research units, when they want to ask for funding from other places, they show the research protocol. So from the down at the bottom of the basic foundation of framing the research question to the end of asking for money, resources, research protocol is the foundation of what is required. And having that in mind, what do you think needs to be, sorry, this is the example of our IRAS platform. It is a platform that we use when we have to apply for ethics approval that needs to be reviewed nationally. Is a at least 56 pages of forms to fill. And all the electronic forms of the components can actually be found in all the research protocol. So essentially, I'm showing you the importance of a research protocol in actually conducting studies that requires ethics approval as well as requiring funding. So bearing that in mind, what do you include? So what do you have to include in the research protocol? Again, put in the chats, speak up, please. Or maybe for the people who wrote yes, like I'm gonna name them, you don't have to be the one who answers, like Dominic, Philomena, or who else says yes, Enoch. For those who says yes, what did you include in your research protocol? Anyone?
Someone says the working title.
Yeah.
Another said a sample.
Yeah, absolutely. What else is there? Maybe is anyone, I don't really want to pick people because it's really nice to just be friendly. We are a collaboration, a fun, friendly group that have to meet on a Friday evening. So maybe someone to just speak up on what did you include in your research protocol? Maybe Dominic? Are you there online?
Hello, I'm here.
Hey, sorry for picking you. Your name's the easiest to pronounce for me. What did you put what did you put in your research protocol? Can you share your experience with us?
Okay, so as I said earlier, I began with my working title and also introduction and a little background into the research I was going to undertake, and as well as justification, and then move to my research questions, then went on to have my objectives, both general and specific objectives, then the methodology that I was going to use.
Yeah.
And went.
Great, thank you. It's really helpful actually to listen to what you have put into your research protocol, because that then helps me to focus on the things that you guys may not normally put in or considered. I'll just ask one more. Someone can volunteer, or I'll just scroll down. I'll give chance. Anyone wants to share what they put in their research protocol? Can be the same. How about Philomena Namali? Are you there? Hi, thank you. Sorry. Yeah, tell me, what did you put for your research protocol?
To add to what Dominic said, you can also include like your sample size, and then if you have to ask for permission or do some ethical consideration, you also include all that to help you have your research protocol.
Yeah, perfect. Thank you so much. Okay. So you're all absolutely right. So the research protocol needs to have a title page. So I'm giving you an example of the research protocol I wrote in 2015 for my PhD, and on the right side. So the first page is the title. I think maybe what you guys have been focused on is the actual research methodology that you are using in a protocol, which is very fair. Forgive, this session is not, I'm not going to go into details of what the difference between aim and objectives are, how many types of studies are there, what statistical analysis do you use for continuous, or this is not a topic of teaching you research methodology, but a very practical view of how to write a protocol. So the first thing you do is of course, your title. Who is your chief investigator, principal investigator? Now, you may be the one who's doing most of the work, but the person who is the chief investigator is the one who's responsible. So it could be your professor, it could be your consultant. Normally, the principal investigator and chief investigator would be the one, when you do write a paper, be the last in your authorship. The one who's overseeing everything is responsible for any outcomes for this. So this is the first thing you need to establish. Now, a research protocol goes through many amendments. And so when you start writing a research protocol, start to keep versions to it, because things do change, and without knowing, it will be the sample size and things will be different. And why is it important to keep versions to it? Because you may be applying an ethics approval of version 5, for example, and it got turned back down and you need to change it to version 6. Have a good habit to keep versions. And these versions are basically the times when it's reviewed by someone already, your supervisor or the ethics committee, and you change it again. So these are versions and date, and you can see that my research protocol has is version 5. It does go up to 6 and 7, depending on how big this research is. So that's the first thing. Then actually, funny enough, what people really need to know is who is sponsoring this and who is funding this. You can have the best idea, but it is important for the funders, or for people who, even as the participant, they want to know that is your research that they are participating sound? Is it going to generate data? Is it worth for them donating or giving their time, or tissue samples or blood products? Some of them get given medication. Is this a sound research question that's being challenged? Who's funding this? So, and that's probably something that you guys haven't mentioned so far, but it's very important to know who's actually study coordinating center, who's the study management group, and which means who's the chief and co investigators. I mentor 2 of the candidates here, and within the second session, what I did was I give them an example of my research protocol with this format, and I'm sure everywhere else has different format, but these are things to include normally in a UK when you need to submit for someone to review it. Contact detail normally would be the person who's responsible for this. So this is really important. Then we're going into the first page. So again, please don't feel this is the only way of doing it, but normally people want to know just a summary. So it's like an abstract where it's just one page. Tell me what the title is, what are your aims, what are the what is the objectives, and what are the outcome measures, and how long are you going to spend your projected spending time on this project. And in a lot of projects that requires samples or analysis of tissues or products, they will actually, or intervention to patient, they will ask you to break down one by one of what each encounter means. For example, the patient needs to come into outpatient clinic, that's one. The patient needs to have a blood sample taken, that's two. The sample needs to send to the lab, that's three. And the lab needs to have certain things done. How does it come back? And they may ask you to break down specifically how many times does each element take. And then some will ask you, and certainly in IRAS, is how much do you predict each one is going to be? So it does go into quite a lot of details, but the first page will be really useful just to give a summary. We're going to go into a real example, and I don't want to take too much time, but you're right. The first thing is literature review, research aim, specific objectives. We all mentioned that already. And then is the design and methodology. So number one page was the kind of overview. Number two is your introduction, your rationale behind. Number three is your research design methodology. That would include your inclusion, exclusion criteria, statistical analysis. And then number four is the regulatory issues. And maybe regulatory issues is something that I see so far that we're not really mentioning in this group. So something that when you speak to your supervisor or mentor in this group to ask them more about, in Ghana, please do educate me. Do things go through ethics approval? Teddy, do research go through ethics approval in Ghana?
Yes, they do.
Okay, I'm sure you. And then there's a local ethics committee, and there's also national ethics committee in the UK. And then that actually breaks down to how you're going to consent the patient. And in our ethical submissions, we actually have to have that already with the consent forms, patient information sent leaflet, all in one package. How do you maintain confidentiality? And you'll come to an example. You actually have to write something like, I will put these paper into a box that will sit in this office that will be locked away. And in 10 years time, we will destroy the papers. That's the details that they want. And how is your quality control and quality assurance in your study? So are these data you're going to collect transparent? Who are you going to allow people to come and examine your data collection? Again, we talked about sponsor and funding. So let me share a real example of an ethics approval. Any questions so far whilst I'm changing the screen?
We will look out for it on the chat and then feedback to you.
That'll be great, thank you. I did open, here we go. Let me stop sharing and then go back to sharing. How do I share? Maybe I'll just go into my desktop. Apologize if you see some, photos of my kids and so on. Can you see my screen now?
Yes, we can.
Okay, so I'm going to give you an example of a study we conducted And it was actually a master's degree I was supervising with my own supervisor, but we are supervising a study that trying to validate a novel simulator called Symbolbox. And please do try not to take screenshots. I'm sure it's fine because it's been submitted to the ethics committee, but I wasn't sure the implication of showing it. So this is showing you read time. This is version 5. You can see we're still amending it. This was 2016. And the aim of this was to test whether this novel simulator Symbolbox, does it improve laparoscopic suturing? So does anyone want to put in a chat or tell me what kind of things to consider? How would you design such a study? Knowing that we're talking methodology, what kind of samples, who do you want to involve or include? So someone wrote in a group, is there a word or page limit in writing a research protocol? The answer to that question for my unit is no. But the research protocol is not a it's not published paper, and it's certainly not a thesis. So it needs to be succinct, and your supervisor should know. Okay, great. So someone's right. Fine. Okay, no, so I don't want to overrun the time. It's already nearly half past. Nobody is answering my question, so I'm just going to run through them, and please do shout out. So what we did was, obviously the main sponsor was in Imperial College. It's important we highlighted the coordinator center was actually surgical skills unit. I was the co-investigator. My supervisor was the chief investigator. Our BSc students was the third co-investigator. And then it's exactly what we did. So introduction and study background. I think we probably don't need to go into too much detail because everybody has different a different study to carry out. But research aim, as I said, number 3 is research design and methodology. So we talked about what's our recruitment procedure. We're going to use our core trainees in CT1 and CT2. What are they going to be doing? They begin allocated into 2 groups. We're going to compare the people who are using a novel simulator trainer set and one with conventional training set. And how we're going to measure their skills acquisition. We use what Symbolbox can provide, which is the overall time, the movement, angular movement, and then we video them to watch them to assess their competencies. What's our inclusion exclusion criteria? It was a very short summer, kind of a 3 months project for BSc students. So all we wanted was 20 participants. May not be the accurate sample size. This was a pilot study for this particular Symbolbox product. Let's look at the regulatory issue. So because this is what we're not so familiar with, we had to submit it to our own local ethics approval. So this was approved by the head of research at Imperial, and this is a very standard what we write. So that we have the consent information leaflet has been obtained, and these are all collected and kept. We talk about everything will be confidential. No identifiable information will be handled. We also talk about that if the relevant data, if the patient or the candidate want to retrieve from the study at any point, they will be fine to do so with no kind of change in how we treat them, essentially. So they talk about withdrawal. We talk about indemnity, who is, if, for example, a student, so a trainee comes and do the Symbolbox and have some kind of eye strain or hurting their arm or something, we've got to cover that of those very small things, these harms, we have insurance policy to do so if anyone want to sue the study. And how do we control the quality? Because we are experienced and it's been the best possible way it's been kept. We talk about how to assess the risk. We talk about the posture. These are really silly, actually, if you think about it, but it is actually important to address. Eye strains, muscle fatigue, tiring from using the simulator, optimized posture, these things. How do they report if there's a complaint? Serious adverse event, what happens? So let's say if 2 out of the 4 trainees use it and their laparoscopic skills in real life deteriorated significantly, this study needs to be closed. This kind of silly things in this setting, but important, very important for other research. Sponsor and funding. How do we audit the data accuracy? What are you going to do with the outcome? How are we going to publish? Contingency plan is what we're going to do if there is adverse or risks. So you'll find that actually a research protocol, your mind and soul is all on about how to conduct this your methodology, but half of the research protocol is on management and ethics. I hope that's been useful. I've taken half an hour already without even trying hard. There's a lot to cover. I have shared my protocol with my 2 mentees. If Teddy, if you wish to have a copy of it, I can amalgamate and give you a protocol that we often use as a standard, and then I can send it to Teddy and to distribute to you. Any questions?
All right. I think there's a question.
Yeah. I'm using deep machine. Thank you, Raphael. I'm using deep machine learning in my research. However, how can we validate such type of models, please? I mean, the data I collected to train the machine and the final model actually like proving their clinical functionality. So that's a research question, and happy to discuss outside as well. But in real machine learning, well, first of all, I'm hoping that you already are within a sound research unit with experts in IT and as well as AR and AI, and I'm sure you have supervisor that can help you. But you have to find something else in validating. Now, validating has different type of validity. So when you validate something, there's construct validity, there's phase validity, there's so you need to work out what are you actually trying to validate. If you're going to validate in seeing is it clinical value, then you need to find something that's a gold standard in clinical value. Let's say if you're doing a CT colon and you're doing a machine learning on whether CT colon pick up polyps for cancer, then your gold standard is colonoscopy. So you would train your AI machine to look at CT colon, and then you have to compare that to the colonoscopy value to see is your AI accurate. That's a short answer to this. Happy to discuss, but I'm not expert in machine learning. Any other questions? Yes, so systematic review, why is it important? Well, you're right, you don't need ethics approval for systematic review. Depending on whether you're doing systematic review and a meta-analysis, it's more important, it's not important for just systematic review on its own. Meta-analysis, yes, so if you imagine research protocol to be something, when you write research protocol, it actually forms the first half of your paper. When you're going to publish, you're going to describe your methodology. How do you come up with the search terms? Because that's going to be the important, the people are going to look at, is your search terms value correct? How do you select what's your inclusion exclusion criteria. You're right. So therefore, there's no regulatory and ethics issues, but writing a research protocol just helps you frame that mindset and then present to your supervisor on whether these, the terms you chose, the methodology, there's still a methodology to use, especially in meta-analysis. Are they sound? But you're right, a simple systematic review does not require a protocol. Anything else? Great. Teddy, I'll hand it back to you.
Thank you. Thank you very much, Alice. It's been a pleasure. Thank you for sharing your
Also, are you
time
on
and knowledge
call?
with us. Yes, I'm on call. I'm on night, actually. I just finished a handover.
Great.
Yes, I'll leave it to Dorcas to introduce Prof. InciSioN. Thank you very much, Alice.
Thank you very much, guys.
Thank you, everyone. It's with much honor I will be introducing Professor InciSioN. Professor Daniel InciSioN is currently the Dean of the School of Medicine and Medical Sciences of the Kwame Nkrumah University of Science and Technology. He's a fellow of the West African College of Physicians and the Ghana College of Physicians and Surgeons. And until his appointment as the Dean of SMS, he was the Deputy Director of Research and Development at CAT, a position he held for 6 years. He's also the head of the Pediatric Emergency Unit of CAT for 10 years. Professor InciSioN has on several occasions acted as the medical director of the Konfano Teaching Hospital. His leadership approach has been found to be shaped by evidence-based decision process, proactiveness, forward-looking team building and cooperativeness. And he has served as an investigator in several pivotal malaria clinical trials in Ghana. And currently he is the principal investigator in the phase 3 malaria vaccine clinical trial currently taking place in Ghana. In addition to his research interest in malaria, he is working with World Health Organization and African region, AFRO, on pediatrics, sepsis and meningitis surveillance program, for which he is the lead clinician. He's an investigator in the Austria Environment Consortium for Enhanced Sepsis Outcomes, ASSESO study in CAT. And he has spent over 2 decades in the care of sickle cell disease patients and has been a key investigator in the Sickle Cell Pan-African Research Consortium and SPACO network. And not only is he a researcher, he has a lot of interest. I really admire that interest in research building capacity in Ghana. And without further ado, I would like to invite Professor InciSioN.
Right, thank you very much. And I think it's a good opportunity to have me on this program. I'm very much happy to be a mentor for the team of mentees that you have given me. And I would want to continue on from where Alice ended on the issue on protocols and proposals. As we in the health arena, you would notice that whatever we do in our clinical practice is based on evidence, is based on what research has revealed, what research questions and answers that has come out is what we are using it to practice. And as we continue to practice medicine, then there will be the need to also continue to research into areas and come out with innovative ways of managing cases and managing systems within our health institutions. I'm looking at the common mistakes that we make when we are writing the research protocol or research proposal. And when you look at the name proposal or protocol, A protocol is a document that is written such that if one does a research and another person would want to replicate that same research and maintain the standards, then it's this document that would be used, and it's like a working document that would enable you to even replicate the same thing, or if you want to vary, then you would have something to base on. So it's like the standards that you, the research person, would want to use to answer a certain research question. Now, we tend to submit protocols and proposals to funding agencies for funding agencies to provide funding. However, we fail to do the right thing that would enable the funding agencies support us. I would want you to keep your questions, and you can even jump in and ask questions as I go through some few slides, and then we'll put the rest into discussions. Now, I think my background is known. I'm a pediatrician, currently the Dean of the School of Medicine and Dentistry, and also doing malaria and vaccine research into malaria, as well as other research support for the World Health Organization. Now, I would look at some of the common mistakes in the proposal writing, discuss how to avoid these mistakes, and the funding agencies that sometimes we would submit our proposals to for funding. Now, I have no disclosures, and some of the images that I would be showing here are not my own creation. They were images that I imported from the World Wide Web. Right. So what are some of the issues that we will be dealing with? Common mistakes. The research topic itself can be a problem. And so when you writing, or if you have a research area that you would want to research to, or you have a research question, then your research question, usually we would want your topic to have some bit of resemblance to your research topic. So in developing your research, if you have a broad research topic, usually you're unable to go through. So for instance, we are in the era of COVID-19, so you would want to give an example of a research topic to say, I would want to investigate COVID-19 outcomes in a population of Ghanaians living in the Upper West region. It is too broad, even though you have some specificities in it that you want an area within Ghana. But someone can just say, I want to investigate COVID-19 outcomes without even specifying the time period, without looking at which category of individuals is doing that. You may have to justify your research topic. And this comes in your introduction and the background that Alice mentioned, to give us what are the scientific evidence for you to go to this, to do this research. If you do not have enough scientific evidence, if you don't have able to establish the clinical equipoise, then there is no need for you to go in. Your proposal would be rejected. That would mean that you must do a lot of literature review, a lot of research work in the area, and read about what others have done and what are the gaps. It is your research that is going to fill those gaps. So if you're unable to justify the research gap, then your research topic, your research area may not be the area to go. She mentioned aims, objectives, research questions. The aims, the objectives, and the research questions, or the research question, the aims and the objectives, they must line up. If you do not have them lined up, and you would have the aim and a different research question, and you have an objective and a different research question, you would have problems with your proposal. The study methodology. For instance, we know we have qualitative research design, quantitative research design, and we have the mixed method. There are certain research questions that your best approach is to be based on a very good theoretical foundation, that for this research question, you think that it's a qualitative work that would reveal the true information to be able to answer a research question. On the other hand, there are some research questions that you would have to do a quantitative research method. A typical example, if you would want to assess the hemoglobin levels of schools children, who are living in a malaria endemic area and find out the prevalence of malaria in this population that have an impact on their hemoglobin levels. You probably will be doing something quantitative. However, if you want to understand the behavior and the practices in the use of bed nets and its impact on the hemoglobin levels of children, then you will realize that you need a mixed method because you're looking at behavior, attitude, and practice. And so there may be the need to do some observations, to be able to do a bit of focus group discussions, the need to be able to do some in-depth interviews to be able to understand their practices. And so if you write your proposal with a very weak theoretical foundation, you would have problems with the proposal. And these are some of the mistakes that we do. Now, with regards to the design, you would want to structure your work that from point A to point B, this is what I'll do. From point B to point C, this is what I do. These are the instruments that I'm going to use. These instruments have these characteristics. This is how the instruments were calibrated, and this is how I'm going to ensure that the specificity and the sensitivity of the instruments are okay throughout the research process. We would want to see all these documentations. The design also would have to be directed to which population, what are your inclusion criteria, your exclusion criteria, what sample size are you considering, how are you estimating the sample size, what sampling method are you using, and why are you using that sampling method? You need to justify all this. This is important because at the end of the day, your protocol or your proposal, someone will say, these findings, let me do the same study using the same methodology, using the same design, and see whether I'm going to get the same results. Once that is done, then the person can walk through your proposal without you directing him. And so whenever you read your research design, you should ask yourself, can someone take my research design and do the same work and would not have to even call me to ask, here, what did you mean by this approach? That is an important information for us. Now, the writing style. The writing style is very important. We usually recommend that the active voice of writing should be used. And there are several online sources that you can go to have training on how to improve on the writing style. And I would recommend that there should be sections on how to do the writing style, because if the writing style is not so good, it also affects the review process. The planning, how do you plan your project? What goes into it? Who are the project managers? And she said it, in you submitting even to the ethics committee, they would want to see how the project is being planned. The reason why they're planning, the design is important is because of the ethical considerations. You cannot subject research participants into a research, and at the end of the day, because of the poor design, because of the weak methodology, you would have weak results and your results cannot be used. And you, in that case, you've wasted the research participants' time, and that is unethical. It brings us to the section of ethical considerations. The common mistakes that we do is that we write the research proposal and we do not pay attention to what are the research implications or the ethical implications to the patient. Safety, well-being, the benefit. And in the area of even informed consent, we need to pay attention to it. It should be clearly stated what are the critical ethical issues within the study, such that you would be able to convince your funding agency that you're not doing anything that is harmful to your study population. Bearing in mind the harm that some research did to patients some years ago. Your budget justification should be very clear. A study that is poorly budgeted is unethical because you recruit patients, you subject them to certain exposures, and you're unable to complete the project because you do not have enough budget. That is really unethical. So the reviewers will look at your budget estimations and would be able to say whether your project or your study can be conducted or not. What are some of the common mistakes? So if you want to avoid this, first of all, what is the purpose of the grant call? That requires your proposal. If the grant call is in COVID, is in HIV, is in tuberculosis, don't put a proposal that is looking at something on infectious disease that is not related to that area. If it's a non-communicable disease, make sure you work towards non-communicable disease. And I'll show you some of the calls that usually comes. They are usually very specific and they tell you what they want. What we fail to do is finding time to read the entire grant call to find out what it is that the funding agency would want and what research questions that you would want to ask. Invariably, they tend to give us what research questions that they would want you to answer. For you to come out with a very good research question, for you to come out with a very good research topic, then your aim, your objectives would follow. What is the research area the funding agency is interested in? If you go online, you would find out that some research agencies are only interested in non-communicable disease. Some are interested in communicable disease, and then you work towards them. You follow their guidelines and their directives carefully. The guidelines are always in depth. For NIH, the NIH grants, you probably would have to devote about 2.5 to 3 hours, sometimes leave it and come back to the core instructions and read it carefully over the time. Most of the time, if you are alone, you are unlikely to skip several key areas within the grant call. It is therefore very important, and I would recommend that for grant applications or for proposals and protocols, you probably would have to form a team, because each and every team member has its own qualities that will bring on board to enable you successfully apply for the grant. Again, identify the interests of the funding agency. Keep in mind that your proposal will be reviewed by experts in the area. The proposals we send, there are other experts across the globe that would look at it. So if you send in a working team tuberculosis, after your team had done that, do a local peer review, present it to your local institution for them to even do a peer review on your proposal before you send it out, because then it goes to the real experts who are asking the questions. Is this research proposal going to answer a research question that would fill a certain research gap? And is the planning adequate? Is the team well prepared to do that? I forgot to talk about the research team here. If you're doing work on, let's say, tuberculosis in adults, a longitudinal study, your research team should comprise of physicians who are respiratory physicians, who are pulmonologists. You probably would have to take some x-rays, so you should have some individuals with imaging background. If it's a study that needs counseling, you need counselors on the study, because you know tuberculosis is stigmatized, and so you need counselors on the study. You would need a pharmacologist on the study because they are on anti-tuberculous drugs, and someone with interest in that. So your research team should be very comprehensive. Most of the time, you may have a very good proposal, and the negative areas that the reviewers would write is that we don't believe the study team is capable of conducting the study because they don't have enough team. We tend to leave out the statisticians. We tend to leave out the epidemiologists. So you need to form a network. Current research direction is network, consortia that does the research work. It's not a group of 1 or 2 persons in a corner wanting to answer a certain research question and want to use just their 2 names. Meanwhile, they are not statisticians, they are not epidemiologists, they don't know how to counsel, they don't have pharmacology background, there is no pharmacologist on it, and you therefore need to sit down and plan your research team very well. That is the angle that research is going. Now, in order to help you avoid some of these mistakes, there are certain very key online sources where you can find enough information. The Equator Network is a very good network that trains and guides young research persons. And even we also have to go there and upgrade ourselves, actually. And they enhance the quality of research and brings transparency into what we do. What it is that they have. If you go to the website, if you are contemplating on writing a proposal on randomized control trial, an observational study, on a systematic review, and even writing a study protocol, a diagnostic research work, a case report, a clinical practice guidelines, a qualitative research, and those even in the veterinary background would go here and they would give you all the various guidelines as to what it is should come into your research protocol, because it's the research protocol and the results that is going to be published, and the publishing outline should follow this. If it's a randomized control trial, then you are looking at the consult guidelines. If it's an observational study, you are looking at the STROBE. Systemic reviews, you are looking at the PRISM, and so on and so forth. You need to visit this website and understand what it is your research question is, what it is your research design is, and which of these reporting guidelines that you need to mirror with your proposal, such that at the end of your study, you may not be found wanting because you have left some key guidelines reporting information in your research work. They train, they support research capacity building. So some of the toolkits within this website will be the research, writing the research, selecting the appropriate reporting guidelines, peer reviewing of research work. And then I've said, do an institutional peer review and do a peer review before you submit it to the funding agency. And this is the site that I would recommend. Again, there is another website, Writing Center. Is a George Mason University. It's a very important website that you would find the IMRAD writing styles and how to do the writing style and write very well. And you would find a lot of resources in this area. At this point, I would want to hold on if there are any questions in the chat box so that I can address them. Okay, so I've seen someone put the Equator Network guidelines in the end. Right. So yes. On the question of why the research. Hello. Yes, Abdul. Come in.
Good evening, Prof. First of all, thank you for your time, for giving us this guidance. My first question has to do with the ethical concern.
Right.
And since you are a pediatrician, especially in children, and also working in Ghana, you are probably, most of us are going to work in areas whereby their mothers, who are usually the one who bring the children to the hospital, are not that well educated to understand what research is. So in terms of gaining consent, how do you go about it? And also, how ethical is it to take blood samples from children? These children are also already afraid of injections and those stuff for research work and those stuff.
Right. Yes. So doing research in children is a different category. You would notice that currently in research guidelines, there are three categories of children or individuals, let me say. There are children, and there are adolescents, and there are the adults. The adults are capable of giving informed consent or having informed consent or making informed decision to be able to conduct the research work on them. In an adolescent, you may have to get the assent from the adolescent as well as the consent from the parents. And it should be the legal parent. It shouldn't be anyone who is not legally related to the patient. And in Ghana, there are clear definitions of who the legal parent is or the legally authorized representative of the subject is. Now, you would, when you come to children, they are even placed into another category called the vulnerable populations, because they do not have the the opportunity to make the informed choice. They do not have the opportunity to even give assent before their parents. So everything is done through them. So in the design of the research work, we try to make sure that the protection, the safety is built within the design of the proposal and the protocol, such that if you would have to take blood samples from the child, if it's a longitudinal study and you would want to take 50 mils of blood per each episode of visit, it will not be allowed by the ethics committee. The ethics committee is composed such that there is a scientist in there, there's a legal officer in there, there's a social person in there, there are people who understand the area of research, and they would look at the safety profile of your research work and decide to recommend that for this subject, you are unable to take 50 mils. Your minimum number of mils to take in this study population is, let's say, less than 10 mils. And if you are doing serious blood sampling condition, then it should probably every quarter or biannually that you would take them. We built all these safety guards within the research proposal. There are some research proposals that have been turned down because of the frequency of bloodletting, or the volume of blood that is being collected, and also the incentives that are given to both parents. We always are very careful with the incentive. If the incentive is too high, it becomes a coercion. So for instance, the study team decided that they would give 500 Ghana cedis to each rural person who present to the site for bloodletting. Meanwhile, the average income for these rural dwellers is, let's say, 75 Ghana cedis every month. Now you go in and you want to give them 500 Ghana cedis. Then every family would want to bring their children to take 50 mils of blood samples from them. That is unethical. So my recommendation is that as you develop your protocol, design your safety nets within the protocol such that you would not have problems with the ethics review committees in your institution, or if it's the Ghana Health Service, then the Ghana Health Service Ethics Committee. Thank you.
Thank you very much, Doc. If you don't mind, I have a follow-up question.
Right.
This might be a bit of, but since I have the opportunity to talk to you. You are a pediatrician. In terms of treatment guidelines, I'm currently studying in Turkey, and I realized that when we are following, especially with lab values, the normal range of values in those labs, the averages in Turkey varies from that of the World Health Organization and that of EU. So usually they have specified guidelines for like the ages of children with their regular range of values. In Ghana, do we have a similar thing, or we always use the WHO standard, the international standards, which I believe might not be a good reflection of our population?
Right. Yeah. So the in terms of guidelines as well as reference values, reference values also are subjected to serious clinical research. If you want to develop a reference value for a typical population, first of all, who are your population? What is the definition of your population? Your population's health standard, because if you have a population that you would want to, let's say, have a reference value for hemoglobin levels, and this population is living in areas where there are issues of malaria, iron deficiency, micronutrient deficiency, that population, their hemoglobin levels, their mean hemoglobin levels may be a little bit below. So in selecting the population for reference level, you must make sure that this population is a healthy population, such that you would have your reference levels developed very well. You would have to have a very good sample size, such that at the end of the day, when you find the mean of that population, that mean will truly represent the population average. Otherwise, you would have a population, you sample the population, but your population sampling was biased. And because you biased the population sample, you would have your mean also biased, and you would be using that to treat your patients, and you have problems. In Ghana, for some time back, we didn't have reference figures for most of our parameters. For instance, random blood sugar, hemoglobin levels, white cell count, all the parameters for the, but I am aware that institutions like Noguchi and also the Kintampo Research Center have done a lot of population-based references values, which can sometimes be used for research as well as for patient care. Thank you.
Thank you very much, Prof.
Right.
I'll have had another question in
Okay.
regards to doctor, but I think it's out of scope. So probably if I could contact through email.
If yes, you can contact me and we can work on that.
Okay.
Is there Lucas, is there any more questions on the chat that we haven't addressed? Okay, there's one here.
I can see one question. So why is a research proposal important in systematic reviews where there are no regulatory and ethics issues?
Why is a research proposal important in a systematic review where there are no regulatory or ethics issues? There are. You realize that, for instance, you would want to answer a systematic review question. I believe all of you here are in the Minnesota. You want to find out whether there has been a research or several research that has been done to find out whether HB levels of 7 is enough to take a patient to the theater to do a major surgery. And so you'd want to do a systematic review on this. Your findings on this systematic review, if it comes out that you would want to confirm that based on your systematic review, HB of 7 is adequate for a major surgery based on your systematic review. It means that this Cochrane review and other review journals are going to, and individuals are going to practice it. If people would want to practice this and it leads to deaths, your reports probably have contributed to this. That is why you would have to, first of all, even when you are writing, you are doing a systematic review, your protocol should be subjected to review, peer review, scientific review, as well as ethical review, such that the way you selecting your research articles, the websites you selecting your articles, the repositories that you are selecting your articles would be considered. Are you doing recent articles or 10 years behind or 50 years articles that you are putting together? The volume of articles that you are putting together to come out with your systematic reviews are all information that you need to tell us what it is that you are doing. Then someone will say, this systematic review that was done, that recommended that HB of 7 is enough for surgery. Let me also do a similar research, systematic review, and see whether I'll come out with the same findings. Now, if you do not know your protocol that you used, your other team that would want to replicate and also confirm what you found may not be able to do it. That is why we always would want to sometimes subject these things into regulatory approvals as well as reviews. Now, the question on does every research study requires ethical approval? Every research work requires ethical considerations, and it's best to submit it to the ethics review board. There are 3 main questions that you answer, and I'll be talking about it briefly. Safety, respect for autonomy, and benefit. So if you assess your research work and that this research work, there's minimal harm, no harm, the safety profile of this research is very high, and the benefit to the society is very high, you can request for a waiver. You can request for expedited review. You understand? Each and every country has several categories of submission. Request for a waiver, request for full review, request for partial review, request for expedited review. You can request for any of these in order to protect your study participants. how do we submit these research protocols for ethical approval in Ghana? So in Ghana, depending on your institution, if you are in K University, you submit it to the K University Ethical Review Board. If Legon has it, UDS has it, UHAS has it. If you are in the Ministry of Health institution, Ghana Health Service, you may have to submit it to the Ghana Health Service, the ethics committees in Accra, opposite the mental health hospital. Noguchi has it, and most of the institutions in Ghana have, and they all have an online application process that you can go on and submit. It says, where and who constitutes the board? I think I've answered that.
Yeah, so far, that's all the questions. For those who still have extra questions on the ethical review, we tackled the topic last month. You can find the video on our YouTube channel. I refer to that.
Okay, so some of the areas to look at. If your research is too difficult, the area you are researching is the disease is very rare, too complex. Your research question is already known. A typical example, you want to find out whether Plasmodium falciparum would cause severe malaria in children. It's already known. You find it difficult to define even what you want to do. Your research will take a long time to manifest. These are areas that the reviewers will look at. You would have to submit your schedule of work, and they can decide that your work, because of your busy nature, you're unable to do this work. And the work is classified as unethical. And I have given some examples. Prevalence of HIV in patients with AB negative. You'll take over 20 years to get AB negative patients, and you will not be able to do it. When you come to the ethics, which we spoke about, the researcher and the participants, integrity is very important, competence is very important, the benefits, autonomy, privacy, confidentiality are areas that you must pay attention to. The research is huge with ethical issues, and you would want to protect your research participants. And therefore, as I said, respect for persons, beneficence, and justice must always be at the background. Vulnerable population, malnourished populations, patients who are displaced are all issues that you must write on in your proposal. What are the ethical issues? The area is already known. You need to make sure it's simple, it's measurable, it's achievable, it's relevant, and there's time bound. So the SMART principle always works. Don't take a question that is too vague. Some research questions are very difficult to answer. Is ectopic pregnancy more common in light-skinned women than in dark-skinned women? How are you going to do it? How are you going to confirm this? So there are certain research questions that you wouldn't even submit for ethical review. Your work should be achievable. The incidence of West Nile virus and P24 antigen in donated blood units in the National Blood Transfusion Center in Harare. First of all, is West Nile disease in Harare, or even if it's in Ghana. So look at your research area, whether you can achieve it before you submit it. Relevant to the area, relevant to the society is very, very important. And the time limit should be considered all the time. There's enough literature around for you to pay attention to. Do a lot of literature search using the online platforms and be able to get a very good research topic, align your research aims, objectives based on it. And this is the only way that you can avoid some of the common mistakes. Now, just a little bit on the funding agencies that will review these proposals. we have the TDR, we have the EDCTP, we have the Malaria Medical Research Council. And when they sent out the call, read the background very carefully, the scope of research work that they would want to give to you several times, and go and come as you are writing your proposal, go back to the scope. Am I aligned to their scope? Otherwise, you would deviate the impact. What is it that they would want us to do? Submission and evaluation process. Look at this. 6 August 2015, 17 hours CET, Central whatever time, or 16 hours GMT. Do not confuse this. 16 hours, 10 minutes, don't submit. You always would have to submit your proposals on the 5th of August 2015, anytime, or 3rd August 2022. Submit it a day before so that you are relaxed. And then you can even go back and look at the work that you have submitted, and if you have issues, you would have to submit. If you delay the last minute, there will be over 200 people submitting it into the same web link, and the web link may be slowed down and you will be unable to submit your research work. You pay attention to all the things that they would want you to do. And so what it is you print this out, you underline some key areas, and you go back and front, you go back to make sure that you are covering the grounds of which the research funding agency requires from you. All these are information that I've mentioned as to where the European Union, the World Health Organization, the US agencies, they all support. Even in Ghana, KNUST have a support research grant, a course that comes on every year biannually that we can submit to. It will either come as request for proposal, RFP, or request for application, RFA, or notice of funding availability, NOFA. And so when you are doing the online search, put in any of these, and the area that you would want to research in, you would find, you get information in. And these are some of the information calls that it's every day. Now we've moved even from malaria, TB, diarrhea diseases, pneumonia, and COVID grants are coming up. So those of you who are interested in infectious disease can go online, ask your research questions, form your consortium, form your team, and write the research proposals. These are the first call that came from the KNUST. Now I think they are on the 11th call that is out for people to apply for. Thank you very much. And I'm ready to take your comments and your questions.
Yeah, thank you very much. Does anyone have a question? Kindly post it in the chat or raise your hand.
If there are no questions, what I would recommend is that forming the networks is a good thing to do. Getting research grants, if InciSioN can be able to look out for the calls that are coming in every month, package the calls, submit it to the groups for them to look at. That will be, they can establish peer review groups within their groups so that when these grants are written or in the process of writing, they can share what they are writing so that they would have the peer review before it goes to the experts for the experts to comment on. Thank you.
Thank you so much, Prof, for this recommendation. I'll follow up together in your law. I thank everyone who has made it to this webinar. We'll have our next webinar series on data collection on the 29th of July, coming on Friday, 29th of July. We hope to see you all. Professor Daniel Ansong and Alice, we thank you so much for making time to be with us and to help us improve on our research skills. I think we've come to the end of it now.
And just one more thing.
Yes.
Yeah, Dorcas. So for those in the systematic review track, we'll be having a question and answer session on the courses you've done on 28th at 8 p.m. Ghana time. So if you've not completed the course, obviously you will not have the link to this, and we'll say bye to you from the program. Yeah.
Have a lovely evening, everyone. Enjoy your weekend.
Same to you.
You too.
Thank you.
Thank you.
Hello, Joshua.